2012-2013 Influenza Information. Family Medical Center. What is influenza? Commonly known as the flu, influenza is a highly contagious infection of the airways caused by the influenza viruses. Outbreaks can happen as early as October, but most often activity peaks in January or later. A, B, and C influenza viruses. Influenza A and B viruses cause seasonal epidemics, while type C viruses cause mild respiratory illness. Influenza A and B strains are included in each year's influenza vaccine. The vaccine does not protect against influenza C viruses. Signs and symptoms. Sudden onset typically starts with a headache, chills, and cough, followed rapidly by fever, loss of appetite, muscle aches and fatigue, runny nose, sneezing, watery eyes, and throat irritation. Nausea, vomiting, and diarrhea may also occur, especially in children. The flu myth. Many people use the term stomach flu to describe illness with nausea, vomiting, and diarrhea. These symptoms can be caused by many different viruses, bacteria, or even parasites. While vomiting, diarrhea, and nausea can sometimes occur when people have influenza, particularly children, these problems are not the main symptoms of influenza. Influenza is a respiratory disease, not a stomach or intestinal disease. How serious is influenza? While the majority of those who become ill will recover, it is estimated that influenza causes about 20,000 hospitalizations and 4,000 deaths in Canada each year. Higher risk individuals include seniors, infants and young children, adults and children with chronic health conditions, healthy pregnant women, Aboriginal peoples, and obese persons. How is influenza spread? The virus is spread mainly from person to person when those with influenza cough or sneeze, which is a droplet spread. The droplets are propelled about 3 feet through the air. People may also become infected by touching an object or a surface that has the influenza virus on it, and when touching their mouth, eyes, or nose. Wash hands thoroughly and often. Treatment of influenza. For non-complicated cases, rest, analgesics, fluids, and time. If you have a complicated case or questions, contact your physician's office for recommendations. Why should I vaccinate? Reasons for receiving the influenza vaccination include prevention of contracting the flu or influenza virus, protection for family and friends or your daily contacts, whom I may spread the virus to if I were to contract the virus. Vaccination information. Trivalent inactivated influenza, TIV, is an inactivated or killed vaccine which cannot cause the influenza disease within the recipient. Live attenuated influenza vaccine, or LAVE, is a live vaccine which cannot cause influenza disease in the vaccine recipient because the virus is attenuated or weakened. However, is contraindicated in immunocompromised individuals. Live vaccination recipients should avoid contact with anyone who is severely immunocompromised for at least 2 weeks following immunization. Vaccination effectiveness. Vaccination protection is usually achieved 2 weeks after immunization. Immunity lasts less than 1 year. Both intranasal mist and intramuscular injections are available. With a good match in viral strains, influenza immunization prevents disease in 70 to 90% of healthy individuals. Influenza vaccination. Alberta Health funds a universal influenza immunization program. All people 6 months and older who live, work, or go to school in Alberta are eligible for vaccine at no charge. Family Medical Center, 2931 20th Avenue South, Lethbridge.